Hey there, I'm Paul, and if you know me or have seen me before, you know my beard is very, very white. And why is it blue right now? Because it is September and it is Prostate Cancer Awareness Month, and I'm a prostate cancer survivor. So I wanted to take a couple minutes and tell my story. My story began in March of 2021. I was going in for a routine physical. We were doing the routine blood work, and on a gut feeling, I asked about a PSA test. My doctor gave me a bunch of excuses how they don't do it unless it's high risk, family history, blah, blah, blah. I come from a very cancerous family. My mother died of lung cancer, my brother died of kidney cancer, father had colon cancer. So I kind of threw that out at him and said, I think I'm in that high risk category. And I insisted on the test. Now, what the PSA test does is it tests for prostate specific antigen, and the normal range is 0 to 4 with your numbers. I came in at 4.25, so slightly elevated. Doctor said, for your age, that's very normal. Don't worry about it. We'll retest in 3 months. 3 months go by and it's 4.42. Again, given the same thing, don't worry about it. We'll retest in 3 months. 5.5. At that point, I was referred to a urologist, and by the time I got in to see him, it was 6.39. So it's going up. We did a MRI. It detected a small lesion along the bottom edge of the prostate gland, and it said it was kind of bulging out on the side. And he recommended surgery to have it removed. I wasn't real keen on the idea of surgery, so I did some research, looked at the treatment options, met with another doctor, a radiation oncologist, and ended up going that route. It just fit better with my expectations, the potential side effects, things like that. I did SBRT, which is a high dose radiation. It took about 2.5 weeks of treatment to get through that. And we've been testing me every 3 to 4 months after that. And my PSA levels have gradually gone down. My last test was last month, and it was zero point 0.6. So I'm in the clear now. They consider it cancer-free or no indication of disease at this point. And we're going to continue to monitor it from here on out. Let me give you some stats on prostate cancer. 1 in 8 men will be diagnosed. 35,000 men in the United States will die this year from it. And it's estimated there are about 3.3 million men in America with prostate cancer right now. Black men are at even higher risk. I think it's 1 in 6 will be diagnosed with them. Right now, the guidelines are to start testing at around age 50. I would actually suggest starting earlier than that, like around 40. At least having the discussion with your doctor about testing, especially if you've got family history of it or are you higher risk, things like that. Advocate for yourself. Take charge of your own health. Don't wait for the doctors to tell you what tests you need. You tell them what you want to have done. And take charge of your health. So I hope that's helpful. And you all have a great day. Y'all take care.